Hey, I'm Dr. Katranji. How's it going? I'm very happy that you're interested in the Katranji Hand Center and everything we have to offer. A very common thing that we have, and we hear it all the time, the number one complaint, when I go to a doctor's office, I have to wait in the waiting room. And it gets really frustrating because obviously your time is very important. And I don't want you to think that while you're waiting in the waiting room, we don't consider your time as important as we feel our time is. Because together, we have to be a team so that we can accomplish everything we need to make you feel better. Now, we can look at a couple of situations in which I, the doctor, or any doctor could be running late. Most importantly, people have to remember, as a physician, I'm a physician 24 hours a day, 7 days a week, which also means that people have to access me almost all the time, especially because I'm in a very special niche specialty called hand and wrist surgery, and I also do elbow surgery, I also do wound care. These are things that sometimes can be quite complicated, so people from all over the state of Michigan very often are calling me to see if I can provide help or assistance to be able to take care of them. And this isn't like for something elective, which means temporary, but these are for emergencies or urgencies, things that need to be addressed right now or as quickly as possible. So sometimes what will happen is that I'll be ready and everything is going very smoothly, and then I'll get 2 or 3 calls that are asking for my attention and for my care to be able to address the needs for other patients because they're in an emergent situation. And it's not that I'd like to ignore or deny the right of my patients as well, but because I have an obligation as a physician and surgeon, and I commit to an oath to help people, I have to be able to answer their calls as well. So I apologize that sometimes it's simply a matter of the fact that I'm taking care of an emergency. And remember, for some of you who are waiting in my waiting room, the first time you met me, you were also that very emergency that I had to may have left the other patients in that same waiting room that you're now waiting for. So that's number one. Number two is sometimes the patient will come in and they may pass out, they may feel sick, they may have other issues, not just simply a hand issue. Or I get reported that this is a simple laceration or a simple cut, and then I discover that this is an actively bleeding wound that needs immediate and urgent attention. So what I would have thought would have been only a 10-minute visit or a 15-minute visit now suddenly becomes a 1-hour ordeal. And not that it's an ordeal to take care of the patient, but it becomes a challenge. I have a whole new issue that I have to take care of, something we didn't plan for or anticipate for. So sometimes what will happen is that person that's sitting next to you in that waiting room may be coming in for what looks like a routine visit, but suddenly that routine visit isn't so routine anymore, and it becomes an emergent and urgent visit. And the third reason that sometimes a doctor runs late is we have to answer calls and paperwork and fill out all these things that the insurance companies ask us to do. So sometimes you're waiting in the waiting room not because we're making you wait in the waiting room, but because we have to make sure we got a prior authorization and other rules that your insurance obligates us that before we can see you, we have to get them beforehand. We try to do this before you come to our office. We try to call you with telehealth, with using our website, with checking out forms early on, or by email or other forms of contact. But what will happen is that despite all that effort, sometimes some insurances say you can't get that number until that patient is in your room. The fourth reason that we could run late is sometimes the patients need to remember that they have to bring everything with them. So we'd love it if you guys could make sure you have your ID with you. We'd love it if you can make sure that you have some form of credit card or form of payment. That's not just simply because we want to make sure we capture it, but it's actually a data verification tool that we use. And at the same time, you may have a copay or a deductible, which we can explain at some other time, that you have to pay before I'm allowed to even see you, because that's a commitment that your contract with your insurance has between you and them. Although they don't expect to explain it to you, they expect me to explain it to you. And so that can add to further delays, as you can see. We can always ask also to make sure that you bring your insurance cards, or if any cards changed. Also, if there's any facts that change, because some of these things can lead to a delay in taking care of patients. For instance, a patient may tell me, hey, look, I'm here for one insurance, but actually they're an automotive accident, or they're a workman's compensation injury, or they're a personal injury situation. And unfortunately, that requires a different set of paperwork, and also different material, a case number. We might need to contact a case manager. So these things we can never always predict from just the scheduling of the appointment, because we trust you to tell us everything you need from us, and we try to schedule accordingly. And it's okay. You know, we take care of each other, and sometimes we run late, and that's totally fine. As long as we help each other and keep each other informed, my patients will tell you, I have no problem coming out and telling the waiting room, I'm sorry we're running late because I'm running behind. I'm trying to catch up on all these emergencies. So what are we going to try to do together so that we can run a little less late? Well, one thing is we try to schedule in a more flexible schedule. So what that means is if you come in and I'm running an hour behind, I have zero problem on my clinic days for you to leave, go do what you need to do. Pick up your kids, pick up your parents, and if you need me to stay longer in my office, I'll take care of that. I'll stay longer just for you because you're that important. And I know you have important things to do, so we're gonna respect your time and give you extra time to see us. Also, if you make an appointment and you decide not to come, please give us a call because that's another important thing. We block for a lot of patients. We try to accommodate everybody. But sometimes what happens is some patients decide not to show up. Well, that can create chaos because we're preparing the rooms, preparing equipment, preparing medications, we're preparing our x-rays, our ultrasounds, and all sorts of tools to help better serve you. But when that person doesn't show up, doesn't communicate, then suddenly we've lost that time. Not only did we lose that time between me and you, but also another patient who's been waiting for an opportunity to see me loses it because I was making sure that I see you first. The next thing that we can do is also making sure all our paperwork is filled out. We have a great website that was been developed by a fantastic person that can give you these easy to fill PDF files that you can easily print them out and sign them, or fill them out and fax them to us, fill them out and email to us. And if there's any other technology way you would advise us to do it so to make it even easier, because you know what, as you can see, I'm a little bit white in the beard, and I don't know necessarily everything about LinkedIn and Facebook and MySpace, and God knows you don't want me to TikTok at all. So the important thing is that if there's anything you can tell us to make it more expedient, more accessible, don't hesitate to call us and tell us. The other thing that we can do to make things faster for everybody, just come yourself and with one other person if you need to. Because of COVID and COVID-19 restrictions, we can't make everything open like it was before. Our bathrooms can't be open all the time. People can't come in when, with whomever they want. And sometimes they have to wait in the car if our waiting room reaches a certain capacity. So again, it's just a matter of me respecting you and you respecting me, we respecting each other and taking better care of each other. So if you give us any suggestions, we're ready to listen to you. If you give us any advice, we're ready to listen to you. We may not be able to apply that advice that instant, but we can definitely apply that advice over time, applying it, educating our staff, and working with each other. There's so many things we can do together to make the waiting room, although it's still going to exist, but as small as possible. So looking forward to seeing you, looking forward to take care of you. I hope this helps. I put this video together thanks to so many people who put reviews for us or contacted us, and I hope that you feel, anybody who's reached out to us, that we're addressing your concerns. And like I said, down below is our phone number, our website, and our email. So if you need any way to reach us to say, hey, look, what about this? I have this idea. We're ready to listen. Take care and have a wonderful summer.